You walk in, you fall over dead. Dead from your own ignorance. Camels are great.
Are they?
It's Dr. Fauci. Happy birthday to me. Hail me, hail me, hail.
All right, so today we got Jamie as usual and our special guest, Derek.
You're welcome. Please call me Boris.
Derek, what's going on with your microphone?
I got lost on the way here. I was driving my bus, stopped for a couple of passer-buyers, hit the gas, and went on the go. Here I am. Thanks for having me on, Mitchell.
That stunned me.
Are you dumbfounded?
Is it dumbfounded or bumfounded?
The bums rush if we keep this act up.
Are you looking at your iPhone 7?
No, I'm looking at my Orbic Wonder.
Is that like the Great Value brand?
Basically.
Gotta love them deals.
We're going to be talking about the new CDC guidelines that have been recently released as of April 27th. And we're going to see what we can and can't do according to the CDC.
Finally, some guidelines. Now I won't get lost when I'm walking around and I'm trying to figure out where I'm going. You know, you got your coronavirus. It's everywhere, Caleb. It's in the air. It's in the air you breathe. It's asymptomatic, but it's out there. And now we'll know. Don't breathe on the microphone. I might eat it later. So does this mean we're still allowed to eat hot dogs?
Well, that's what we're about to find out. What can we and can't we do?
Well, as what he said, about 4th of July, we may get to eat hot dogs with all of our family members.
Unless Dr. Fauci eats them first.
Exactly.
Nothing better than a raw hot dog, am I right? Raw.
What about hamburgers, though?
Hamburgers. Not bad.
This is about choosing safer activities. When fully vaccinated, you can start doing things you had stopped because of the pandemic. If you are fully vaccinated, you can start doing many things that you had stopped doing because of the pandemic. When choosing safer activities, consider how COVID-19 is spreading in your community, the number of people participating in the activity, and the location of the activity.
When do you think I should reveal that my legs are fake? And my body is sentient. The legs are not attached, actually.
Yeah.
Watch them float away. Ah!
Outdoor visits and activities are safer than indoor activities, and fully vaccinated people can participate in some outdoor events safely without much risk.
Fully vaccinated people can walk or hammer.
If you haven't been vaccinated yet, find a vaccine.
Yeah, find one.
Find one.
Dig in the dirt. There it is.
COVID-19 vaccines are effective at protecting you from getting sick. Based on what we know about COVID-19 vaccines, people who have been fully vaccinated can start to do some things that they had stopped doing because of the pandemic. We're still learning how vaccines will affect the spread of COVID-19. After you've been fully vaccinated against COVID-19, you should keep taking precautions like wearing a mask, staying 6 feet apart from others, and avoiding crowds and poorly ventilated spaces, indoor public places until we know more. These recommendations can help you make decisions.
Stop, I think you're giving him a heart attack.
Oh, sorry, I didn't see. Are you okay, Derek?
I'm fine, actually. I feel great. I had an animal cracker, but it was in the shape of a whale. Whales aren't animals.
That's true.
They're mammals, but they don't have udders.
Or do they?
Should I Photoshop udders on whales?
Yeah, sure. Go ahead.
Not that part.
Okay, but
Rhinos have udders?
it says these recommendations can help you make decisions about daily activities after you are fully vaccinated. They are not intended for healthcare settings.
Wow.
Have you been fully vaccinated? In general, people are considered fully vaccinated 2 weeks after their second dose in a two-dose
Considered
series,
fully vaccinated 2 days after they die.
such as the Pfizer or the Pfizer. I think it's just Pfizer.
Yeah,
Wait,
it's usually Pfizer.
Pfizer.
Is it?
I guess so.
That was a sister
How do you spell it?
vaccine.
Whenever I hear like Johnson & Johnson vaccines, I always think of like the baby company.
Yeah.
How many Johnsons are out there in the real world anyways? 4?
2 weeks after a single-dose vaccine such as Johnson & Johnson's Janssen vaccine.
Johnson & Johnson's Janssen.
If you don't meet these requirements, you are not fully vaccinated, not in all capitals. Keep taking all precautions until you are fully vaccinated.
Better triple mask up your donkey.
Or your camel.
Or your camel. Put a mask on the hump. Look at it. It's going up the pyramids. That's what camels do. They run up pyramids. Pyramid, camel. Up. Camels are great.
Are they?
Camels drink water like dogs with the backwards tongue thing.
If you have a condition or are taking medications that weaken your immune system, you may not be fully protected, even if you're fully vaccinated. Talk to your healthcare provider. Even after vaccination, you may need to continue taking all precautions. What you can start to do, okay, this is where it gets interesting.
You're lying.
If you've been fully vaccinated, you can gather indoors with fully vaccinated people without wearing a mask or staying 6 feet apart.
Wow, that's crazy. Imagine doing that. Imagine doing that. Just if you got vaccinated, you could actually do that.
But nobody wants to.
Nobody can.
Yeah. Everybody's like, how dare you?
You can gather indoors with unvaccinated people of any age from one other household. For example, visiting with relatives who all live together without masks or staying 6 feet apart, unless any of those people or anyone they live with has an increased risk for severe illness from COVID-19.
You can't get to somebody's house if they're at risk, Caleb.
It's unrealistic.
It's not gonna
because
work.
In real life, every situation is different. Like, they don't know who lives where.
Whether or not they know, it won't work.
Yeah, I
If you're
know,
not vaccinated, Caleb, it's not gonna. You won't be able to pull it off.
Okay, yeah, I see what you're doing.
If they're at risk, you walk in, you fall over dead. Dead from your own ignorance.
Okay, what else can you do? You can gather or conduct activities outdoors without wearing a mask, except in certain crowded settings and venues.
But people still do. I've seen people running with masks.
Yeah, it's because they're afraid.
I've seen people eat with masks.
Yep.
I've seen people drop a deuce with a mask.
I was once told that all you need is a mask, and that it's completely fine if you just never wash your hands as long as you never touch anything. I'm not even kidding.
Somebody did
Someone lectured me about that.
Well, Caleb, it's because the virus only travels through the air. It only travels through the air. You could lick somebody on the back of their knee.
But then it'd be
You won't get it. But if you take the mask off, you're dead. It's not a joke. It's serious.
100%.
It's a serious disease, COVID-17.
It's just like that.
COVID-17. If you travel in the United States, you do not need
These
to get
great
tested
United States
before.
of America. Say it.
If you travel in the great United States of America, you do not need to get tested before or after travel or self-quarantine after travel. You know all about that.
I do. Except for the fact on my plane, they recommend that when I got to Chicago, that it would be like, you have to wait for 10 days. And I was like, nobody's gonna know. It's like,
Here, we have a little play place. We got like one of those little plastic houses with the little, what do you call them? The abacuses. It has an abacus and a little tic-tac-toe board.
I love the abacus
You
when
hang
I
out
wait
there
at the
for 10
dentist
days.
office.
Yeah.
they feed you, maybe they don't.
Give you some McDonald's hamburger buns. The extra buns that they don't use for the burgers. Because they're all like wrong size. One of these days I'm going to crush the libs with facts and logic.
You need to pay close attention to the situation at your international destination before traveling outside the United States. You do not need to get tested before leaving the United States unless your destination requires it. You still need to show a negative test result or documentation of recovery from COVID-19 before boarding an international flight to the United States.
Like you go to a church and then like they're about to pray. They're like, wait, we haven't read the new CDC guidelines.
Oh no!
Dr. Fauci's like, read them and weep, boys.
You should still get tested 3 to 5 days after international travel. You do not need to self-quarantine after arriving in the United States.
They're gonna say 3 to 5 days a week. Get tested 3 to 5 days a week.
If you've been around someone who has COVID-19, you do not need to stay away from others.
You're already dead.
Or get tested unless if you have symptoms. However, if you live in a group setting like a correctional or detention facility or group home and are around someone who has COVID-19, you should still stay away from others for 14 days and get tested, even if you don't have symptoms.
Diarrhea but a symptom?
Diarrhea butt.
Diarrhea blood?
But.
Butt.
B-U-T-T-E.
Boutte.
Is that a symptom? I don't know. Because if it is, I think I had it before the virus was released. I was part of the development of the virus, actually.
Next section. What you should keep doing. This is basically what not to change. So everything we just read is everything that you can do differently now.
Let's see. Is this the make or break moment?
Yeah.
Because this is the moment when we see if they're just going to instantly contradict everything they just said.
Yeah, exactly.
Because they basically just said you can do whatever you want, except for hang out with people who have coronavirus.
Yeah.
And people who could die.
People
from
who
it.
knowingly have it. Unless if you're living in a group home, whatever that is.
Or a detention.
I don't care. Yeah, or a detention facility. Then you worry about asymptomatic spread for some
Or a
reason.
playground.
Or a playground.
With children sneezing all over the swings, licking their hands and grabbing the chains.
Okay, what you should keep doing. For now, if you've been fully vaccinated, you should still protect yourself and others in many situations by wearing a mask that fits snugly against the sides of your face and doesn't have gaps.
I think you said gas.
That's what I thought too.
Take this precaution wherever you are.
So they're already going against what they just said, which was
Yeah.
basically,
Yeah.
like before they were like, in these very few situations, like people who may have coronavirus or people who are in danger from it, you should avoid them.
This is the difference. Take this precaution whenever you are in indoor public settings, gathering indoors with unvaccinated people, including children, from more than one other household.
Why did the CDC hate children so much?
That's a good question. Visiting indoors with an unvaccinated person who has an increased risk of severe illness or death from COVID-19, or who lives with a person at increased risk. If you travel, you should still take steps to protect yourself and others. You will still be required to wear a mask on planes, buses, trains, and other forms of public transportation, traveling into, within, or out of the United States. And in U.S. transportation hubs such as airports and stations, fully vaccinated international travelers arriving in the United States are still required to get tested within 3 days of their flight or show documentation of recovery from COVID-19 in the past 3 months, and should still get tested 3 to 5 days after their trip.
So, like, basically, it's a retard vaccine. So you might as well just not get it.
Facts.
Because everybody thought, like, oh, these new guidelines will probably encourage people to get it.
Yeah.
No, you still can't do anything.
Has the CDC ever explicitly said that you have to wear your mask outdoors?
No.
But now they're saying that you can go outside without a mask.
That's all you get out of the vaccine is the ability to go outside, which you could already do, and gather with family, which you could do if...
Only one household, though.
So the two things you can do when you get the vaccine was stuff everybody was already doing without the vaccine. Wow.
Exactly.
What a scientific revelation. Go on, Caleb.
You should still watch out for symptoms of COVID-19, especially if you've been around someone who is sick. If you have symptoms of COVID-19, you
probably
should
the
get tested
cold,
and stay
moron.
home and stay away from others.
Others.
Like the odds that you got the vaccine and then you got coronavirus, you probably just got a different sickness and they accidentally called it out as coronavirus because the testing's also very flawed.
I mean, the flu kind of disappeared, you know?
Derek loves to talk about that.
Yeah.
I'm pretty sure the flu also never existed.
Oh,
They're both fake.
At this point,
It's just people
there's
overreacting
never
over
been such a
nothing.
thing as the flu.
They both were products of commie trash. But the best part is that they're not even real.
dun, dun, dun.
Now the flu's real. It's just gone.
You will still need to follow guidance at your workplace.
No, Caleb, listen. I want to clarify. I honestly believe we've cured the flu.
Okay.
We honestly cured it. I could say that with 100% confidence. It's gone. Because why would they say that there's no flu cases if there were? It's basic common sense. Dr. Fauci came to me in a dream and he said, Derek, my son. I said, what? And he said, the flu's gone.
People who have a condition or are taking medications that weaken the immune system should talk to their healthcare provider to discuss their activities. They may need to keep taking all precautions to prevent COVID-19. So that's what you should keep doing. Now we're going on to what we know. This is just 2 short paragraphs.
I think I say 2 short words. Nothing.
Shut up.
Nothing. What do we know? Nothing.
COVID-19 vaccines are effective at preventing COVID-19 disease, especially severe illness and death. Other prevention steps help stop the spread of COVID-19, and that these steps are still important, even as vaccines are being distributed. Wow, that's all they know? That's in the what we know
It's basically,
section?
what they do know is that the vaccine might help. That's basically what they just said.
Big might.
What do we know? What do we know, fellas? What do we know? Let's look at the chart. It might work.
What we're still learning. After all this time, we're
Learning
still
how to use our
Brains.
Early data shows the vaccines may work against some variants, but could be less effective against others. How well the vaccines protect people with weakened immune systems, including people who take immunosuppressive medications. How well COVID-19 vaccines keep people from spreading the disease. Early data show that vaccines may help keep people from spreading COVID-19, but we are learning more and more as people get vaccinated. How long COVID-19 vaccines can protect people?
Never.
How long? How long can it protect people? How long indeed? Who knows? It could be a day. It could be 2 days.
50
It could
years.
be 3 days. We're still counting every day. And frankly, everybody dies after 4 days after they get the vaccine. But then we rotate in the clones. The clone people, we call them. The ones that would come after.
What are you saying over there?
The ones that come after the vaccine. We wipe out the human race with a cure to a fake disease that is the actual
Derek,
killer.
I can't hear you speak up.
And then after you die, we replace you with commie trash. The clone people. The retards will be weeded out.
I didn't quite catch that last bit. What did you say?
I said, go on, Caleb, we're waiting.
Oh, thank you. Okay, so CDC will continue to update our recommendations for both people vaccinated and unvaccinated. Until we know more about those questions, everyone, even people who've had their vaccines, should continue to take steps to protect themselves and others when recommended. Want to learn more about these recommendations? Read our expanded interim public health stupidness. So that's it. That's the whole update. There's a lot of like little links that add to it, like, you know, steps to protect themselves and others.
As far as I can
should
tell,
I click on that?
No. As far as I can tell, the only thing they've added is that now you can go outside without a mask, which was that was never even a rule. They just didn't confirm it until now.
Yeah.
Is that what I'm gathering? That's the only thing that you can do now that you couldn't do before is go outside?
Basically, I think like what Joe Biden said, like,
You can go outside, fat.
it was like,
Look, man,
you can go outside
come on.
now, he says as he goes outside with his mask on.
Yep.
Yeah, he goes on camera. He goes on video, online chats with his mask on. Because the man's retarded, Caleb.
Has anyone actually fully followed the CDC guidelines?
Probably not.
They've been pretty loose about how to prevent it. Like, they're not the most strict. They just say, like, take these precautions and recommendations. Because remember, doctors say it's a recommendation. Politicians say it's an absolute law that you must wear your mask. Or they wish it was,
yeah.
at least a lot of them. Telling you have to wear a mask. But if you don't, We'll tell people to be afraid of you and that you're doing nothing to help anyone and that you should just die.
But we don't care about the ones that don't care.
They care about everyone except for healthy, productive people.
Damn.
That actually makes a lot of sense.
I wanted to say this at the beginning of the video, but I completely forgot. I was wondering if they were going to talk at all about like people who are immune after getting the virus itself. They still don't talk about that.
If you brought it up, people are like, the who? The people who got the virus and survived? You know, the people that no one ever mentions ever?
You know the I Survived books? There needs to be one on COVID-19.
That'd be a hilarious parody joke, like a parody book. I survived COVID. Here's how I survived COVID-19 by Direct.
By
Direct Strong Noodle.
So the only advance we've made is that now you can have one other household visit you.
And you can go outside.
And you can go outside as long as it's not like too intense.
People don't even consider this. This is literally based on nothing. This is just them assuming what would probably make sense. It's like, well, you probably can go outside now. It's not like there's really any testing for this stuff.
Yeah.
It's not like, oh yeah, we took like 5 people with coronavirus and put them with 10 people that didn't have coronavirus in this setting under these specific conditions, and we watched it spread, and this is how we can tell you what you can and can't do.
Yeah.
Have I ever mentioned how much I hate wet carrots?
This doctor says, masking remains one of the least intrusive interventions we can take to keep putting the brakes on COVID-19 spread.
Are we a car?
It's like the least intrusive thing we could possibly think of is that we force you all to stay home and never see anybody.
And hiding your face.
Don't question it. Just do. I just wanted Dr. Fauci to be like, I love the way the sheep obey. It's incredible what you can make people do just by saying I'm a doctor.
All right, so I guess that's that. We learned
Nothing.
nothing.
The only thing that's worse is that now you have vaccine supremacists walking around.
Oh gosh, it's worse. It's way
Yeah.
worse.
They do act like, they're like, I got the vaccine, but I wear a mask anyway, so I don't look like a Republican.
You know, that'd be interesting, like
Somebody
test.
actually said that.
Really.
They only wear the mask so they don't look like a Republican.